Bangalore, it is as far as the hearing loss is concerned, it is quite bad, mainly because of two things. Now, because of the noise pollution, which is very high. You know, the Bangalore is one of the 7 cities in the country which is got the highest noise pollution. Apart from that, the infrastructure also is very bad. There are a lot of dust and other things going on. And as far as the hearing loss, there are almost 5 children, newborn children in 1,000 will suffer from severe degree of hearing loss, who require an intervention as early as possible after birth.
Right.
Newborn children, it may be either because of their prematurity, or there may be some associated defects like chromosomal abnormalities or hereditary causes, or during birth if they suffer from severe degree of anoxia, means if they don't cry immediately, or if they have a less oxygenation to the brain, that can cause, or immediately after birth they also have sometimes severe degree of jaundice, which can give rise to this hearing loss, as well as even a meningeal infection like meningitis in the perinatal period also can give rise to very bad hearing loss in children. Yeah, we have been doing this early hearing detection program in our center also, but it is not available everywhere in the country, because this early detection can be done in a newborn children even as old as just 3-4 days. We in fact ask the pediatrician, the gynecologist, to send for this hearing evaluation or do it in their ward itself, like the otoacoustic emission test, before discharging the patient after delivery. The newer technologies, of course, is once the hearing loss is detected in these children, or whether it is in the adults also, severe degree of hearing loss, they can be fitted with the hearing aids, appropriate hearing aids after a hearing aid trial, which is suitable for that particular loss, and train them for the speech therapy. So for 3 to 6 months. So if they are getting benefit with the hearing aid, they will go ahead with the therapy. Otherwise, if they are not benefiting, then they go for a newer technology called the cochlear implantation, where we implant this electrode, which has got 2 parts. One is the inside part, which is by surgery, it is implanted inside the body in the mastoid bone, and the cochlear electrodes will be going inside the cochlea. And outside they will be wearing, after about 3 to 4 weeks, the sound processor with a microphone, which help them to listen to the sound and the speech, and they can understand with training, listening training and speech training. They will be able to listen and understand the speech, and they will be able to develop good speech. With the cochlear implant, almost it is they are almost the hearing loss which they have about a 90-95% hearing loss, which can come up to about 20-25 decibels, which we call it as well within the speech banana limit, so that they will be able to understand, listen and speak also.